Welcome to Sacred Birth Sessions. I am Jessica Pierre, and if you're looking for more than surface level birth stories and advice, you are in the right place. This is where preparation replaces panic, questions are welcomed, and women learn to trust themselves through pregnancy, birth, and beyond. So take a deep breath, settle in, and let's get into today's session. All right, so I want to talk about 4 words that absolutely can crush somebody who's been laboring for hours. And that is, you're still 4 centimeters. Still. That little word. Because now she's thinking, I've been contracting all this time for that. I've literally watched the whole energy in the birth room change after a cervical check. Before the check, mom's working, she's breathing, she's moving, she's doing all the things, and then somebody, the provider, comes in and gives her a number that's not what she expected. And then suddenly she thinks that her body's not working. But here's what attending birth after birth has taught me as a doula. Labor doesn't care about our little charts. And cervical dilation is information, but it's not the entire story. So one thing I've noticed as a doula is how quickly everybody becomes obsessed with the cervix. How many centimeters is she? When was she last checked? Has she changed? She's been at 5 centimeters for how long? And don't get me wrong, cervical dilation gives us useful information, but sometimes we start treating it like driving from Tampa to Orlando. Like, you're at mile marker 1, now mile marker 2, now 3, now 4, and eventually you'll arrive to 10. But birth does not always look like that. Now, I've seen women sit at the same dilation for hours and then move quickly and become fully dilated, ready to push. I've also seen women make cervical change with barely even looking like they're uncomfortable, with or without medications. And I've also seen women labor intensely for hours and have less change than everybody expected. Because during birth, other things are happening. Baby's moving, baby's rotating to come out. The cervix itself is changing and the body is adjusting. And sometimes the work that's happening inside isn't immediately reflected by dramatic different numbers when it comes to cervical checks. I remember one mom I supported. She went in for an induction a couple weeks before her estimated due date. And we went through the whole process. I did remind her before we got things started that this is an induction, a medical induction. So, number 1, this is your first baby and your body has never done this before. So it might take a little bit longer than anticipated. So just mentally prepare yourself for that. And 2, with all of the medications and things, it's basically forcing your body to do something before it is actually ready. So please keep that in mind. So we went through the whole process. They offered to break her water at a certain point, and she agreed. She progressed a little, and then she didn't. And then she progressed a little bit more, and then she didn't. She ended up getting an epidural closer to about 7 centimeters. And Soon after, it had been about 24 hours since they had broken her water. And she got all the way to 9 centimeters. And then she got a fever. And then baby's heart rate started to increase. And that basically means that she had gotten an infection. Her water had been broken for an extended amount of time. And with all the cervical checks and everything like that going on, she ended up getting an infection. So she had gotten to, like I said, 9 centimeters. And she ended up having to go back for a C-section because of the infection. They didn't want to give her any more time. It had been pretty much their time limit that they usually give, which is about 24 hours. And they gave her a quick minute to kind of process the fact that she had to go back for a C-section. And she, as soon as the doctor stepped out or the provider stepped out, she broke down in tears. The energy in that room shifted tremendously. She was discouraged. Her mom tried to kind of hold it together. And it just got heavy in the room. The energy was just weighing all of us down. And I remember thinking, as she was progressing, we have got to stop letting one number convince us that all the work they did just didn't count. You know, she ended up breaking down crying. Her mom tried to, like I said, hold it together. And she's like, oh, I did all of this for nothing. And I just tried to kind of keep her as grounded as possible. Like, you did everything you could imagine that you could have done to bring your baby here. No, it's not the way that you wanted or you envisioned. However, your baby's going to be here soon, and you both are going to be healthy. Let's focus on that. So she ended up, going back and having baby, and baby was healthy. She was healthy. Baby's probably like a year old at this point, but that one number, that cervical dilation, is apparently like a huge impact on a lot of people. And that's not the only part of the story that matters. Like, even with just cervical dilation, it's not only dilation, which is the opening of your cervix, it's also the effacement, which is the thinning of your cervix. It's also the position of baby, the station of where baby is in your pelvic bone, how high or how low. So there's a lot that goes on. It's just not that one number. And here's another piece of this that I don't think we talk about enough. Like I said a little bit earlier, there's more to the story than just that one number of how dilated you are. What we don't talk about enough is the difference between you're only 4 centimeters and you're 4 centimeters, but baby's coming down and your body's continuing to work. Same cervix, completely different emotional experience. Words matter in labor, because that person in labor is already doing something incredibly demanding. So when we communicate progress as disappointment, sometimes she internalizes that disappointment. And that's when I, as a doula, hear, my body's not doing what it's supposed to do. I can't do this. Something must be wrong. And not necessarily. You only got a piece of that information. That's all. And this is probably one of the questions I hear most during labor. Jess, how much longer? And y'all, I wish I had a crystal ball. I really do. because I would be so rich, but I don't. And neither does anybody else in that room. What we do is we can recognize patterns. We can look at the clinical picture. We can make educational or educated estimates. But birth still has an element of unpredictability. And sometimes constantly asking how much longer makes labor feel harder, because you're mentally trying to finish something that your body's asking you to experience one moment at a time. It's asking you to relax. It's asking you to trust it. And sometimes my job in that room becomes bringing mom back to the contraction, not the 10 centimeters, not the pushing, not meeting the baby. This one. Let's get through this one contraction. Then we'll deal with the next one until that comes. I am the one to keep mom and sometimes everybody in the room grounded. Because pressure from partners, from friends, from family, it doesn't always help. Now, I don't want anyone hearing this and thinking I'm saying that time never matters, because of course it does. Of course there are those clinical situations where providers are watching labor progress for important reasons. At the end of the day, maternal well-being matters. Babies' well-being matters. The entire clinical picture matters. But there's a difference with understanding why your care team isn't concerned and simply feeling like I'm taking too long. Those aren't the same thing. And this is where questions become valuable. Instead of immediately hearing we haven't made much progress and translating that into something's wrong, you can turn around and ask, well, how's baby doing? How am I doing? What specifically are we concerned about? And what are our options from here? You can even ask something like, do we need to make a decision now? Like I always tell my clients, use that BRAIN acronym. What are the benefits? What are the risks? What are the alternatives? Use your intuition and then ask, what if we do nothing? Then what? What'll happen? Now you're having a conversation instead of just being told what to do or what to think. I really wish women understood before labor that progress is not always dramatic. Sometimes progress looks like centimeters, and sometimes it looks like baby's position changing. Sometimes it looks like finally being able to rest. Sometimes it's an emotional shift. Sometimes nothing appears to be happening until suddenly a whole lot happens. So please don't let the word only convince you that your body hasn't been working. I've literally been at home waiting for a client to call me in. Now, with me personally, I go in when mom's in active labor, so that's about 5 to 6 centimeters, and contractions are about 3 minutes apart or so. And I've had a client that was 3 centimeters, and she's like, okay, I'm 3 centimeters, I'll keep you posted. And I was checking on her about every hour or two, and suddenly she texted me and like, hey, I'm getting ready to push. So guess what? I missed that birth. Because within an hour and a half, 2 hours, she went from 3 centimeters to ready to push. So birth definitely is unpredictable at times. And guess what? This was her first baby. So again, very, very unpredictable. So let's actually get into the listener letter. So let me go ahead and pull that up here. All right, so it says, "Hi Jessica, I'm pregnant with my first baby and I'm starting to get nervous about knowing when to go to the hospital. My mom keeps telling me that when she had me, she waited too long and almost had me in the car. So now she's making me nervous. My provider gave me the basic contraction instructions, but I've never heard so many stories of women being sent home. Oh no, I've heard so many stories of women being sent home because there were only 2 or 3 centimeters. I live about 35 minutes from the hospital and I don't want to go too early, but I definitely don't want to be having my baby. I definitely don't want to be having my baby on the interstate either. How do you usually help your doula clients figure out when it's actually time to go?" So I actually love this question because there are so many different things that I've heard as far as knowing when to go to the hospital. So this is actually the exact kind of thing that first time moms worry about a lot. And first, your mom's birth doesn't automatically predict yours. This is where a lot of our fears come from our parents or our moms or our grandmothers, our sisters, people around us who have had babies. And this also is why I don't like reducing labor to one magic number or one magic rule. I think that you should pay attention to your provider's instructions, whatever they gave you, but also pay attention to your contraction pattern. I give my clients a contraction timer app that they download on their phone, and they press it as soon as they start feeling a contraction, and they press it again when it stops. And this particular app, it monitors your contractions, tells you the time frame between contractions and how long your contractions are lasting. And then I believe there are apps that also tell you like, hey, your contractions are picking up in frequency. Maybe it's time for you to get your bag together and head to the hospital. But another thing I want you to also pay attention to is the intensity, and also have your partner pay attention as well, the intensity and how you're responding to your contractions, and also your behavior changes, because once your contractions start to get more frequent and more intense, your eyes may close. You may or may not be able to speak through your contractions. Pay attention to if your water has broken or not. Pay attention to see if you have any discharge or any bloody show, any bleeding at all. Pay attention to the baby's movements. I know you said you're about 35 minutes away from the hospital, but so make sure you have everything packed. I've also had certain moms stay at like a hotel right down the street from the hospital, but these are more so moms who are like an hour away. And I've actually had moms who live about an hour away. They went to get checked and they're maybe 3 centimeters and they were sent home, but they didn't want to go all the way home, so they got a hotel room not too far from the hospital to kind of labor and wait it out, and then headed back to the hospital. And also pay attention to your individual medical situation. It depends. Are you high risk? Do you have gestational diabetes? Do you have high blood pressure or hypertension, preeclampsia? Does baby have anything going on? All of these things matter when it comes to preparing for when to go into the hospital. If you have none of this stuff going on, still pay attention to the contraction patterns and your frequency. I remember when I was pregnant with my son and I felt my very first contraction. Right before I felt it, now I know the feeling, but I literally felt him drop into the birth canal a little bit lower. I felt it. And then soon after, I started feeling contractions, and I felt one contraction, and I'm like, what is that? Mind you, this is like 1 o'clock in the morning. I'm laying on the couch, and I'm actually on the phone with my best friend at the time. And I felt something. I didn't know what it was. Now I know it was a contraction. And I looked at the time and I'm just like, all right, 1:10 a.m. Cool. Let me keep that in mind. And literally 10 minutes later, I felt it again. And I'm just like, And I literally told my best friend at the time, I'm like, okay, so if I feel whatever I'm feeling in about 10 minutes or so, I think I may be going into labor, because I was actually 39 weeks exactly at that time. And sure enough, I felt it again. So I was like, okay, I'm going to get off the phone with you now. I need to concentrate. And I got my notebook. This was before all the fancy apps and stuff like that. So I got my spiral notebook. I got my pen. I had the TV on. I was staying with my mom at the time because I didn't want to stay by myself, even though my apartment was literally behind the hospital. And so I wrote down my contractions, the times they started and everything. And I labored by myself for the first maybe 3 or 4 hours. I labored by myself, breathing through contractions, because I didn't want to wake anybody up and it be false, So, pay attention to all of these things. And then if you have a doula, once you start feeling those things, call your doula. Us doulas know that we're on call for you. So even if it's in the middle of the night, reach out, text, and if you don't hear anything in like 10-15 minutes, call your doula and let her know. Me personally, I tell my clients all the time, if you call me in the middle of the night, I know that it's for an emergency. I'm aware of what I signed up for. So please take that time to call me and find out what you think you should do, because you can't call your provider in the middle of the night. Even if you have the on-call number, you still have to wait for somebody to call you back. So for me personally, sometimes I can hear the difference in the client's voice before she even tells me how close the contractions are. So just, pay attention to all of that. And you should know between how you feel, that app, and speaking to your doula, if you have one, that you should possibly go into the hospital. So that is my 2 cents. Thank you so much for writing in. I love to hear from you guys. This is amazing. I love to talk about these things and speak about my own, personal experience as a doula, as a birth assistant, and as a mom myself, because everybody goes through different things and has different experiences. So there you go. So all in all of these topics that we talk about, this is why I created the Sacred Birth Blueprint, especially with this person here writing in, grabbing that fear from what her mom experienced. Inside of Sacred Birth Blueprint, we talk about fear and where it may come from and how to recognize that, and then also how to work through that and work on yourself instead of taking everything from outside sources. I don't want for the first time you're thinking about all of these things while you're actually contracting, while you're tired, while you're emotional and trying to make decisions and all of that. In Sacred Birth Blueprint, we prepare beforehand. We talk through all of the possibilities. We talk about all of the possible potential questions. And then we build the confidence that's needed to help navigate birth, even when it doesn't follow like a perfect timeline. So if you would like to find out more information about Sacred Birth Blueprint, please email me at connect@sacredbirthsessions.com. And like I always say, I would so love to hear from you. I am building this from scratch. So I have my curriculum, I have my workbook, and we're going to go through all of this information step by step. Again, it's an 8-week course, about an hour to an hour and a half once a week, and we'll go through all things preparing you for birth and a little bit about postpartum as well, because preparing for postpartum is just as important. You do not want to wing it. So please email me if you have any questions, DM me, reach out in any type of way. So thank you so much for spending this time with me. And if today's session made you think differently about labor, please send this to someone who is preparing for birth. And remember, your cervix is giving us information. It's not giving you a grade. So stay informed, stay grounded, trust yourself, and I will see you in the next session. Peace, blessings, and abundance.